With you, Dr. MAGDY ABDEL. Welcome, everybody. I am consultant of infectious disease, hepatology, and gastroenterology. Today, our topic about familial Mediterranean fever. This disease is inflammatory hereditary disorder due to defect in gene on a specific chromosome. This gene codes inflammatory process. If this gene is defected, so there is difficulty in control of inflammatory process. Usually the disease manifested between 5 years and 15 years. Usually males more than females. It usually present in people around Mediterranean Sea, like Kurds, Armenian, Italian, Greek, Arab, Jews. So the disease manifested by attacks or bouts of fever and pain. Usually the pain may be in the abdomen, and sometimes we think it appendicitis or cholecystitis, and sometimes we make operations, but lately we know that the patient has familial Mediterranean fever. Also, sometimes the pain comes in the chest, and the patient suffer from chest pain and difficulty in breathing because the inflammation affects the pleura. Also, sometimes the attack comes in the heart, and the disease affects the pericardium. Sometimes the pain comes in scrotal and affect tunica vaginalis. So also may affect the joints and lead to arthritis. So it is polycerositis. This disease affects the serosal covering of the abdomen or the chest or the heart. So this inflammatory disorder usually come in attacks, but in 90% of the cases the patient suffer from abdominal pain accompanied by fever. So as regards the investigation, we make chromosomal study, and we find the patient whether heterozygous or homozygous. Usually in homozygous, the condition become more severe and prolonged. As regards the treatment, colchicine drug give good results. Usually the dose between half mg to 2 mg, but sometimes we increase the dose according the weight of the patient. About 65% of cases respond very well to colchicine, and the attacks disappear. But about 30% of the cases, the condition present but more less, and the attacks become less frequent. But 5% of the cases do not respond to colchicine, and sometimes we give another biological drugs like anakinra and canakinumab. These both drugs give good results, but we have also to give colchicine because colchicine, number one, decrease the intensity of the disease. Number two, the attacks become less frequent. Number 3, it delay amyloidosis. So we have to follow up this patient by making serum amyloid at least every 6 months. As regards this patient, sometimes in attack we find white blood corpuscles increased, sedimentation rate or C-reactive protein also elevated. But we depend in the diagnosis on chromosomal study. But sometimes chromosomal studies show negative results. But we find that the patient suffer from familial Mediterranean fever in spite of negative results. But this is very rare. So, as regards the complication of the disease, this patient may suffer from amyloidosis, and this leads to renal failure. So, colchicine gives good results to delay this amyloidosis. So, every case of familial Mediterranean fever must take colchicine. Sometimes, if female pregnant, also we give colchicine. Colchicine not risky for pregnancy, and we give the doctor who look after this pregnant lady, who takes the decision which continue on colchicine or no. But we know many cases pregnant sometimes suffer from abortions. The percentage is more high in pregnant female suffering from familial Mediterranean fever. So this treatment must continue for life. As regards some medications like ketoconazole, erythromycin, diltiazem, we avoid to give these medications to patients of familial Mediterranean fever. Also avoid grapefruit. This patient need social support, and also this patient suffer from absence from schools and from the work. So we have to make social support for this patient. Thank you very much.